You know, so many people deal with the pain of neuropathy on a daily basis. And, you know, they've tried different things as far as trying to get relief for the neuropathy pain. And sometimes it just doesn't work. Well, this young lady right here has gotten some relief. GiGi, how are you? So good to see you again.
I'm very good. How are you?
Wonderful. Thank you very much. Tell us about you were dealing with as far as your neuropathy pain.
Well, it started probably maybe 5-6 years ago. I started to get some numbness in my toes, and then it proceeded up to my legs, all the way to the knees. And then I got tingling and numbness, and then pain, all of a sudden pain. And it was, I did not like it. Went to the doctor, he prescribed me some pills for my pain, but he couldn't do nothing about neuropathy. He just told me I have neuropathy in my legs.
And that was it.
That was
like,
it.
Take the pills or no relief.
Yeah.
How did you find out about Dr. Spencer?
Well, I got 2 phone calls from 2 friends of mine because the new K-laser treatment came out and Dr. Spencer is doing it, and they told me, you got to go to see her because she does the neuropathy. I went there, I had 11 treatments, and I'm doing great right now. My pain is gone. Probably after the 3rd, 4th, or 5th treatment, the pain was totally gone. I have a little bit numbness right now, all this, but I have improved about 90%.
90%?
Yes, yes. I go to sleep at night. I don't want to chop my legs off and say, I'll put you back on in the morning.
So what would you tell other people that are dealing with neuropathy pain about Dr. Spencer and the K-laser?
Well, I have already told quite a few people about it, and I told them that TRICARE for Life and Medicare is not paying for it, but that she has a payment plan. And then they said, oh, we cannot afford it. And I tell them, I said, you buy a house, you can afford the payment for the house. You treat your legs, you can afford the treatment for your legs.
That's a good way to put it.
Yeah.
That's it. Well, I'm so glad you're doing so well.
I'm doing great.
That's awesome. Go dancing? I know I've seen you out dancing before.
Oh yeah, well, we have some performances coming up.
Okay, well, good. GiGi, always a pleasure to see you.
Same here. You take care. Okay?
Take care,
Bye-bye.
too. Let's talk to Dr. Spencer now and find out how you can get some relief from neuropathy pain with the K-laser. What a great testimonial.
It was, Jim. It was fantastic. And that's why I'm doing this, because I love getting great results with patients.
Nice. She was saying that 2 friends called her. What she didn't say on camera was one friend was watching the show, called her from Biloxi. Another one from Gulfport or Long Beach, they got Ocean Springs, called her too, and told her, said, "Are you seeing this?" She's like, "No, you got to turn this on. You get some relief from it." And here she came.
I know, it's great. And that's one of the reasons why we do these segments, to help people understand that they can get relief without drugs and surgery and, the things like that. And this is a totally natural treatment. And how it works is the K-laser neuropathy treatment for pain, the pain of neuropathy. Neuropathy comes from a variety of outside causes. But what is actually happening to the cells is you're not getting circulation, and your nerves are slowly dying, and it's a very painful, slow process. Most people don't realize that neuropathy is the #1 cause of amputation in the United States. So it's and it's a very progressive disease, and so even though you may be taking medication for neuropathy, it's only helping with the pain of the problem, and the disease.
It's a mask. It's a Band-Aid.
Right. And so how the K-laser is different is that it works really hard at increasing the metabolism, the circulation, and how everything is working to bring in those nutrients so the cells can have everything that they need to heal. And the numbness, the tingling, the pain, when the processes are given, when all of the cells are given everything that they need to heal, guess what happens to the patient?
They're healed.
Well, they begin to get feeling back in their feet when they have not been feeling it, or as GiGi expressed, the pain of the neuropathy was keeping them up all night long.
I know her whole example of wanting to cut her legs off and set them aside because I guess it causes maybe RLS, restless leg syndrome.
Well, that can be something that happens, yes, but people tell me after their treatments, after they begin to get some relief, that they no longer have that severe nighttime pain that they were having that's keeping them from sleeping all night. That's something I hear, like they feel like their legs are on fire My legs don't feel like they're on fire anymore, you know, and I feel like I'm starting to be able to walk a little bit better and do more of my, I can feel my feet when I press the gas pedals. Really important.
Yeah, thank you.
So we have a lot of patients that are driving that can't actually even feel their feet. And, you know, they're in fear of losing their ability to be able to drive. And
and that could be a serious problem for those who maybe have stairs in their home. They're not sure going up and down there. So, am I touching the stair?
Yes.
And I'm sure a lot of accidents happen like that.
Absolutely. Well, many times when people come in, they've already fallen multiple times because, you know, they've just lost the ability to connect to the lower part of their body. And it's just like it doesn't even exist for them anymore, that brain-body connection to the lower part, and they hope that their legs are where they think they are and their feet are where they think they are, but they don't know for sure. So when you have to look down at what your legs are doing all the time, guess what? You get into a bad posture, and that starts to affect other things. You see people all the time in the store that are walking around like this, looking at their feet. Well, that's not good for your health. You're meant to be upright and stand upright and take big breaths and shoulders back and have good posture. And good posture brings good health. So I'm really excited to have this neuropathy treatment. I trained on this in Nashville with 2 doctors that have been doing it for several years. I'm following their protocols exactly. And we're getting the exact same results that they told me I would get, which is over 90% effective in treating the symptoms of neuropathy.
Wow.
Yes.
Now, once you get to that 90% point, I know, how often do they come in, first of all, to get treatments?
Well, it's going to depend on what
The severity,
what we find in their initial examination. Usually it's a several-week protocol to heal the nerves and so forth, and we do a re-exam in some type of interim process. But we haven't had a patient yet who has not gotten any results, so it's been fantastic.
Well, I know GiGi was just, was just tickled to death about the results that she's had. So, I know that it's something that, of course, if you want some more information about it, what you can do is go to your website, set up an appointment with you,
right,
and come in for a consultation and an exam and find out how severe it is.
How severe it is and what we can do to help you. And one of the things I can tell you is my most severest cases seem to be getting some of the best results.
Really? That's awesome. Something else, I mean, it's always so educational to come and talk to you and find out some of the great things that you can have done to make your life better.
That's right. Thank you for coming, Jim, and it's always a pleasure to have you here as well.
Always a pleasure here. Spencer Chiropractic, Pass Road Gulfport, across from Pass Road Elementary.